All right, what is going on, YouTube? We're back in here today. I'm doing another quick video. Some people have reached out to me and have asked me to do a video comparing and contrasting pharmaceutical sales to medical device sales. So before that's done, we're almost to 300 subscribers here, which isn't a lot in the grand scheme of things, but to me, it's a lot more than what I started with. So if you wouldn't mind hitting that subscribe button, that's the only thing that's going to help me grow. That, along with the like button, is going to help get it out to more people. So without further ado, we'll get right into it. So what I do, I am, a med device guy, as they've always said, it's certain equipment that we're using for doctors, showing them how it works and servicing the patients. So, the difference kind of in this, I want to go over pharmaceutical sales first. A lot of the times, pharmaceutical sales will just be more so relationship based than device roles, because they're going into the doctor, they're getting the script signed, they're offering their support to the physicians for questions regarding the drugs. But however, they go in, they get their script signed, they get the sale, they get paid, that kind of thing. It's not that easy in med device, especially for what I do. You have surgeons, you have to be in there in the OR, in the cases for as long as it takes. You're on trauma call. You have to make sure that all the devices are good, that everything on the instrumentation is wrapped up and ready to go for the surgeons and sterile, and then everything is in its proper place. So device can be a lot more of a service component than I think pharmaceuticals can be. Both are great. Both have, their pros and cons. I will also say, surgeons use devices a lot. They have to use those devices, those instrumentation, navigation systems, those kind of things. So kind of by default, they're going to be using that. So you can build that relationship that way because you'll be with them a lot of the time. Whereas pharmaceutical reps, you're going to be doing a lot of lunches, a lot of office meetings, bringing a lot of coffees, those kind of things, well within your means that what you can do company wise. So pay obviously can be a lot for both. You have a large pharmaceutical business versus a large, medical device business, you can still make a good amount of money with both of them. So, here's some things to consider when you're considering both of them. If you want more free time, pharmaceutical rep, you will absolutely have more free time with. You're not going to be on call. You're not going to have to do things outside of hours a lot of the time. Now, I don't know that exactly for a fact. I've never done pharmaceutical rep, but I do know for sure that it will be a lot less time consuming than what I do now as being an OR rep. So there's that to consider. So if you have a family, you want to go that way, they're very important to you, you want more time with them, pharmaceutical rep might be your way to go if you can do that. If you want more hands-on time with the surgeons, there is a great meaning, being the guy that can pull a surgeon out of the dirt and get him out of a situation that he is in. If you want that, you're kind of a workaholic, you're more handy, you want to be involved constantly. Maybe med device is going to be more for you. Both jobs are very hard to get. Both jobs are hard to get without, experience. Even if you do have experience, a lot of people that get into these roles stay in them for a very long period of time. So, I would apply to both. If you're in the process of applying to a med device job, apply to as many as you can. See what you can, interview, network, that kind of thing. Now, starting in both jobs, I will say when you're starting in a device role, especially an OR device role, if you don't have experience, it's going to be a lot harder to hit the ground running than it would be in a pharma role, because there's going to be so many things that you don't know when you get in there that you're going to have to sort of learn on the fly, and it's going to be like drinking from a water hose, where if you are in pharma, you might just be able to sort of mark out your territory, figure out doctors you're going to go try and schedule lunches. If you're in device and you already have a book of business that you're kind of walking into as an assistant role, it is a lot like a trial by fire. So these are all things to consider. Reach out to me, add me on LinkedIn at Matt Moran. It's in the link down below. Be happy to chat with any of you. Shoot me an email, whatever you want to do. All right, take care.